this computer.
Perfect. Well, welcome everyone. I'm super excited to be here and start off the new year. Picking these back up, I'm super excited to hear Michael speak on this topic. I am the Director of Outreach for Fusion Academy, our Houston Galleria campus in our Sugar Land. We do have 80 other Fusions all over the US. Fusion is a fully accredited private school and it's 6th through 12th grade. And it's one-to-one personalized education. So every class will be that one teacher to one student. We serve a lot of students that may struggle with anxiety, depression, ADHD, and it really just provides that environment to help these students overcome whatever they may be going through. So if you have anyone in mind, you can send them my way, and I'd love to help, give them information on what we can do and serve. So thank you.
Thanks, Brooke. Julie, you'd like to say a few words?
Hi, everyone. Sure. My name is Julie Pomerantz. I'm with the Hub Houston. Hub is an acronym for Heard, Understood, Believed in. And we now have, 4 different programs. I'll sum them up very quickly. First of all, for all of our programs, we tend to serve mostly those who are on the autism spectrum from about mid-functioning to very high functioning. Also those with ADHD, anxiety, depression, high functioning Down syndrome, anyone in that area. We do have a school for ages 13 to 18. We have another campus that serves young adults ages 18 and over called Life 101, where we're helping with employability and just helping them to move on to their next stage in life. We have a club that meets at night, a social club ages 18 and over called Club Hub. And finally, we have a program called Aspire Accessories for ages 18 and over, where they are creating magnificent items that are sold in markets and online, and they're paid for their work and they do magnificent work. And so nice to see you all here today. Happy New Year to everyone.
Happy New Year, Julie.
Thank
Okay,
you.
Miss Pam, would you take
All right. Good. I guess it's good afternoon already. My name's Pam Esser. I'm Executive Director of the Attention Deficit Disorders Association Southern Region. That's why we go by ATA-SR. We've been around since 1987, and we offer support groups and educational events and other resources. At the moment, we are all virtual. So in addition to this one with Dr. Ron and our other sponsors, we have 4 others per month that are free. Some are for adults, some are more for parents. And I'm pleased to announce in February, we have a great one coming up with 3 CEs. It's Belinda Gauthier, who was former president of CHAD, and she's been in HR for over 40 years. And we get a lot of questions from adults about disclosure in the workplace. So she's going to handle all of that. So check it out, and I'll try to drop it in the chat as well to share. Thank you. Glad to be.
And Alexandra, would you like to tell them about us?
Yes. Hi, I'm Alexandra. I'm the children and adolescent therapist here at the Brain Center, and we do EEGs. Our team of neurologists look for neurobiomarkers that could account for symptoms, and then that helps us develop a treatment plan. We also provide neurofeedback services, photobiomodulation services, and talk therapy.
And we're about to start hyperbaric oxygen. So
yes, we're excited about that.
Okay, great. Thank you for everybody being here. I'll go ahead and say a few words about how I met Michael. We were at a conference in Swatzyna, California, and he was one of the speakers. And we have a lot of different speakers with a lot of different talents, but I will have to say his way of presenting things makes it so clear. I was really impressed with that, and got to be pretty close with him in a very short period of time, and we've had lots of discussions. We're starting to work together to bring his expertise into all the regions. All we need is an MD that he can consult with, because he's not licensed in all states. But and when it comes to advanced advanced testing so that we can figure out what's going on. We don't get simple cases. We get very complex cases. And sometimes the normal blood work that we would send out for just doesn't come back. So this is what Michael's going to talk about. So I don't want to get into all your different background, Michael, but would you introduce yourself and tell a little bit about how you got into this and what you're doing now, and then go on with your presentation.
Well, sure. Thanks, everybody. And Ron, this is an honor. I'm really glad to be here. I started out in this as a kid, kind of blindly. I was a sick kid with some bad skin and some bad brain function. And about 7 years old, my parents looked at my diet and our family's diet, because we ate, standard American diet, largely crap. And we decided that we'd clean it up, and we did, and it cured me. And so that changed my life and that of my family. And we kind of just kept going ever since. My mom was a La Leche League leader. And so I grew up in that environment of helping see families and women take care of each other and their babies and how to breastfeed naturally. I then began to work with different people through families for the Feingold diet and for different diets and prevention and natural food things back in the 70s. I went to college and enjoyed a bunch of science in college and music and philosophy and medicine, and then ended up getting hurt in sports, and chiropractors fixed me up, and I decided I really need to be a chiropractor. So I went to chiropractic school, and I found out in chiropractic school that I had a bunch of family members that went way back to the 1920s and earlier that were chiropractors that went to my school, to Palmer in Iowa. And I got out of chiropractic school, and I got snapped up by a orthomolecular psychiatrist, and I worked in a retreat center taking care of people with mental health issues and nutrition in Missouri, in a wonderful 2,000-acre, 100-bed facility with about 30 staff. And we worked on everything from ADHD to cancer to alternative medicine for everything. It was really very exciting, and we did some amazing work. I graduated with a toxicology honors from Palmer. And I went on to study toxicology and to do a little bit more in neurology. And I did go to chef school and worked on that. I led a coma recovery team in Minnesota under the Northwestern Health Sciences University, where I was teaching neurology interns. And I think that's where I learned the most, was teaching my interns, because they ask you tough questions. They don't hold back, and they have enough knowledge to kick your butt. So my interns taught me the most I ever learned. And I think that's the real thing. I've taught for a bunch of continuing ed courses for the last almost 30 years throughout the United States for industry, supplement companies and lab companies, pharmacy, lab, and supplement companies. And I still do some of that now. I consult for designing products and formulating products, and I teach for labs. And in fact, I'm scheduled to teach for Nutridyne in a couple months in Colorado. So yeah, I've got a lot of experience in that world, and I'd love to share some with you and talk more and answer questions and hear more about you guys. Oh, Ron, you're muted.
Sounds great. On with the show.
Okay, well, my job is really three pillars. I'm going to share my screen with you and get onto my PowerPoint here. I do chiropractic neurology, which is a board certification. I'm actually on the board for helping write the exam, and that's a wonderful nation or worldwide board that actually is the American Chiropractic Neurology Board, but they do a good job worldwide with certifying functional neurology and doing the exam. It involves neurology and psychology, and it's a really, really interesting group. We tend to do things that are neuro rehab. That means doing a neurological examination and trying to figure out what parts of the brain might need rehab exercises. That might mean vestibular exercises. That might mean brain or sensory exercises like you'd see in autism. It might mean all kinds of rehabilitation where we flash lights and checkers in people's eyes and do somatosensory evoked potentials as therapy. We stimulate the tongue, we stimulate the visual system, we do clicks in the ears to stimulate the midbrain. We do all kinds of work for coma and for brain injuries and for strokes and recovery. And then we also do nutrition. Some of us do nutrition work where we do lab testing, and that's what today's talk is going to be about. And I also do QEEG and neurofeedback. It's a near and dear thing to me. I've been doing for years, and I'm learning at the feet of these guys and ladies and really learning a lot of great things. But the fundamental part about brain function is that brain cells are cells, and cells need oxygen, and they need fuel, and they need activation. So if we can provide them all those three things, they can do amazing stuff for us as long as we can help them detoxify. So when we improve brain function, one of the things we want to do is talk about how we really have to we have to pour out the bad stuff that's in the body. I was talking to Ron about this before. We've all been exposed to toxins, some more than others, and we have to get rid of those toxins. And those toxins can be measured in the urine, they can be measured in the hair, they can be measured in the blood, and they can be inferred by your work experience or even your war experience. And so what we try to do is figure out what kind of pathway your body is taxed under, and then try to detoxify that by stimulating enzyme systems and genes with herbs and foods and vitamins and meditation and neurofeedback and TDCS and stuff like that. So the general approach is try to get rid of the bad stuff and then put in the good stuff. In America today, in the United States, we have a lot of problems with getting the good stuff in. We're all mineral deficient. We're largely fat deficient. We're deficient in saturated fats. We get some vitamins, but we don't always get the right form of vitamins. We get manufactured petroleum-based vitamins. And so we really don't get the good stuff into us. And a lot of times we get the macros wrong, which is the ratio of proteins and fats to carbohydrates. So with emotion and mental health, which is really kind of my bent for the last, I don't know, probably 20 of the last 30 years is really, although that's right where I started at too, was mental health for the first 5 years of practice with those orthomolecular psychiatrists. And, you know, they learned a lot and they taught me a lot. And so counselors come to me all the time as a consulting neurologist with questions, and their usual question is twofold. They usually say, am I picking the wrong counseling method? Or am I picking the wrong neurofeedback? And most of the time I'll look at their QEEGs and I'll look at their intakes and I'll say, you know, I really don't think that you're making a mistake here. I think there's something else that's missing. This brain has some kind of organic brain syndrome. It's got some kind of deficiency or a problem with, say, you know, one of the most common ones you'll ever run into is this metallothionein 3 problem, where this protein called metallothionein 3, which is present in humans and horses and a bunch of other mammals, is not being manufactured enough because of a chronic zinc deficiency. And so you end up with a real problem in your hippocampus and in your brain. You can't regulate your image of yourself. You get things like eating disorders. You get things like body dysmorphic disorders. You get things like problems with the hippocampus regulating the adrenal glands, and you get abnormal cortisol rhythms. And so this is one of the biggest things you'll see is a real simple zinc deficiency among Americans and Western society. And a lot of that's from a lot of the lectins and a lot of the foods that people eat that are binders that bind to minerals. If you simply eat a plate of beans with a zinc supplement, you're going to lose about half of that zinc that you would normally absorb just by eating the anti-nutrients in the plate of beans. Now, I'm not saying all beans are bad all the time. I'm just saying that if you've got a mineral problem, you might need to know about the chemistry of beans and plants. So this really is food and macros, protein, fat, carb ratios. It's about supplements that you take. It's about elimination diets. It's about functional neurology and brain exercises that I talked about before, things like EMDR that you guys use. Now, I'm not a counselor. I've been in the world of counseling, and I've sat in thousands of hours of counseling and group therapy and family therapy, and I really love it, and I've studied the mechanisms, but I don't counsel, and I'm not licensed to counsel. My job is to support you in your counseling and your neurofeedback when and if it doesn't work. So, you know, most people don't need me because it's, you know, I work with the tough cases. So I do QEEG and ERP and neurofeedback methods. I'm studying under Yuri Kropotov and trying to get my head around ERPs. I've done some ERP work in the past, but quite frankly, I don't feel it was very good, and I'm trying to do better. So I've got a YouTube channel called The Human Condition. Here it is. And I hope you enjoy it. It's growing, and it's under some guidance from some really good people. So it's going to get even better. I hope to interview some of you on there. And we're also planning on doing some really interesting worldwide grand rounds with my network of people around the world. I've got past interns and colleagues that I've taught or that have taught me around the world. And so we're going to have an international group of doctors that are doing grand rounds. Look for that to come in the future, online grand rounds. And so what we're talking about today is brain chemistry assessments. There are really two ways to assess a brain. And one is a science-based lab method where you do lab testing, and that feels very grounded and feels very good. But the problem is we don't have all lab tests for all things. So the other way to assess the brain is what medicine has always been, which is observation, history taking, wisdom, observation of skin and hair and nails and diet and gas and listening to the abdomen with the stethoscope and watching people's eating habits and listening to their family tell them and rat on them when they tell them about their bad habits. So some things are not testable by labs, like, for example, lectins. You can't test for lectins. We know that lectins exist and they've been proven, and hundreds of people get a Ph.D. in lectin chemistry every year. But And there's textbooks written on these lectins and these anti-nutrients, but some things can't be tested very well, and you have to do an elimination diet, and you have to do a clinical reasoning. And so you can't throw out the idea that a good clinician who is trained in physical medicine can understand how to look at the diet, look at the reactions, and most important, to understand that the most common reaction that you're going to see in people is a skin reaction. One of the most common reactions is a skin reaction, because the skin and the brain derive from the same dermal layer in the embryo. And so you're going to see a lot of atopic dermatitis, skin atopy, and eczema. These are all the same thing. And if you read textbooks, you'll see that almost every immunology textbook will tell you in a very early phase of an early chapter that, that almost all skin atopy is non-antibody mediated, which means you can do all the antibody tests you want for autoimmune disease and for food antibodies and for antibodies to antigens in the air like pollens and dust and dander, and you're not going to find it, because most of these things are non-antibody mediated immune responses, which means they're very primitive and they don't fire off the specific immune system, they fire off the non-specific immune system. And that's another lecture for another time. But the real thing that I have to work with, both in my doctors and my patients, is unlearning the propaganda, which is the first step. And I have had to do this myself, because I was trained, even as a chiropractor in a holistic school, I was trained a lot of myths that we really got to get rid of. And here's a bunch of them. 6 servings of whole grains a day. Really? Are you kidding me? Fat and dietary cholesterol cause vessel plaque. Oh, come on. This has not been true. And it was a myth started in the 1950s, and it really needs to be booted out. Fiber is always good for you and always harmless. That's not true. Red meat causes cancer. Boy, the studies that showed red meat causes cancer were quite flawed and filled with all kinds of reasons why they were flawed. And we can talk about that later. All vegan diets are healthier all the time? Well, not necessarily. I support vegan diets and people that are really committed to them, and I help them. But sometimes if I've got a person with a tough brain, I've got to put them on vegan keto. And that's the only way I can turn them around. Vitamins and minerals cannot change mental health. Well, that's been the American Psychiatric Association's line since Linus Pauling was alive, and it's not correct. Violence and serious diagnoses like schizophrenia require heavy medication, and food has no effect on them. Food couldn't possibly affect things like schizophrenia. Well, I think William Walsh might argue with that, and I'll talk about that a little bit later. Food additives are totally safe. Food dyes, coal tar dyes, which come from petroleum products like FD&C yellow number 5 and red number 40. These things are totally safe, huh? They've been tested and they're totally safe, and they don't cause any lung disorders. They don't cause any liver disorders. They don't cause any cancers. Interesting. So I'd like to know what you think about that stuff, and we'll have you chime in just a minute here. So what is testable? Let's talk about the secure world of what is testable. There is a lot that's testable, and I don't advocate that you test everything that's available, because you're going to spend thousands and thousands of dollars that may be unnecessary, and you're going to be jerked down a road that involves a lack of critical thinking if you just order every test that's available in nutrition and in chemistry, because you won't be able to prioritize. So it's very important that you learn to prioritize the chemistry that you're facing based on the person's symptoms, their medical history, and your observation of their skin, hair, nails, their guts, their digestion, even their breath and their urine, the color of their urine. I mean, in Ayurveda, they'll take a bowl of a patient's urine and froth it up with a whisk and smell it to diagnose things like diabetes and things like ketones. And so, to some degree, we still do that. In fact, I was really humbled in my first job when I worked in that retreat center years ago. My first job involved being a doctor, but I also cleaned toilets. And when we went in there, one of the things we would do is this was a surreptitious lesson by my teacher, but we were in there learning stool analysis. We would go in there and we would learn stool analysis. And at one point we actually started getting smart, and we would ask the patients to take us into the toilet and show us their stools and show us their urine so that we could interpret it for them. And boy, let me tell you, people get better a lot faster when doctors are looking over their shoulder, helping them figure out what their stool means. And most importantly, the stools of their children, when their children are sick and their children are having crazy stools. So there's blood tests, there's urine organic acids that measure metabolism, there's hair heavy metals, measure for chronic metal exposure. Now realize too that blood tests for heavy metal exposures are good, but they're only good for about 9 weeks. If you read the literature, you'll see that they only measure circulating metals for about 9 weeks after industrial exposure, because most of what we know about heavy metals comes from an industrial exposure in mines and in the tailings from drilling out metals and doing things to metals with drill bits, and with melting and smelting and pouring and molding and making these things out of metal. There's gases, there's vapors, there's shavings and all kinds of material that we can absorb through our skin, we can breathe through our noses, we can swallow, and we can get mixed in water. So hair heavy metals is the best way to measure a chronic heavy metal exposure in the body. You can use urine and stool for clearance, and you can use blood for acute, but you really would use hair for chronic full body burden. You can use fingernails too, but that's much more rare. There's urine molds. There's tests for urine mold, and I'm a big fan of measuring the actual burden of mold toxins in a person's body instead of just antibodies. A lot of people measure antibodies to mold, and I don't think that that's always the way to go. I think the actual toxicology is the way to go, although every case is different. There are urine measures of solvents and pesticides. There's some really great urine tests. Great Plains Lab does a wonderful glyphosate test that William Shaw has over there in Kansas City. And the great Stephanie Seneff, who wrote Toxic Legacy, has been talking about that quite a bit. She's an MIT scientist. And so she's been talking about that quite a bit. The pesticides like organophosphates and the heavy metals that are in fertilizers, the solvents that are in gasoline like MBTE, mental health panels. Dr. William Walsh, not William Shaw. William Shaw is the guy who runs Great Plains Lab. He's a toxicologist that used to work for the CDC. William Walsh is a biochemist that started the Walsh Institute that followed from the Pfeiffer Institute when Carl Pfeiffer followed that from Linus Pauling and his institute, which was the founding of orthomolecular psychiatry. And so William Walsh is still alive today and a wonderful teacher of mine, and I'm certified in his methods. There are a fantastic series of tests that are done to measure mental health and nutrition. And they look at zinc and copper. They look at ceruloplasmin. They look at metallothionein-3. They look at methylation. And they look at cryptopyroluria, which is a disorder of hemoglobin formation that shows up in urine. And it can make people feel really, really crazy. And all of these things are treatable with nutritional methods. And he's got astounding cure rates of people that he's been treating. He's got 30,000 patients that he's treated and listed in his books. And he's got 10,000 people that he worked on in the Chicago corrections facilities, basically prisoners that were violent prisoners that he worked with. And his rates of success are extremely high with taking care of these people. There's stool parasites that we can look at. There's a lot of protozoans that can affect people and bacteria and dysbiosis. And there's, of course, antibody immune testing, which I really do like. I do a lot of neuroautoimmune work, but that gets complicated. And that's another lecture, because there is antibody testing that can lead you astray. And there's antibody testing that can really, really help you, along with some other general immune function testing that should be done in people. And we may get to that today, but that's fairly complex. What's not available for lab testing, and where you feel often very much less secure, is where there's no lab tests. And so there's a few things like that where there's not great lab tests. And lectins are probably the biggest one. These are plant defense proteins that plants use to defend themselves from animals eating them too much so that they would die. Because plants don't have teeth, and they don't have hooves, and they don't have horns, so they need lectins. And these lectins are a rudimentary immune system, kind of like the first antibodies that evolved. I love evolutionary biology. Haptens are small molecules, small molecular weight proteins that really can't fire off the immune system by themselves. But once they get into your body and they bind to some protein like albumin or some other protein, they cause an immune complex. And they were first studied as insect venoms, like Dr. Ben Feingold, the guy who invented the Feingold diet. What a quack he was. Just kidding. He was studying insect venoms of insects and trying to show how mosquitoes worked. And that led to the understanding of food additives and coal tar dyes and how they worked in children to cause hyperactivity. And he was roundly drummed out of the science world even until after his death. And it turns out he was right about a lot of this stuff. Carbs alone, carb ratios, there's a whole world of carbs and insulin resistance that we can talk about. There is gluten intolerance and gluten sensitivity that is not celiac disease. There's also we kind of call it brain celiac, which is the difference between the HLA-B2 gene and the HLA-8 and not B, I'm sorry, the HLA2 and 8 genes. These are the genes that determine whether your reaction to gluten is more in your brain or more in your gut. And I don't know about you, but when I was in school, we didn't know about a brain reaction to gluten. We only knew about the gut reaction. So that can be tested for in genes. It can be tested for with antibodies, but you can't really test for it if it's a sensitivity that doesn't have an antibody. Sulfur intolerance. Sulfur intolerance is something that can be implied with SNP testing. You can do SNP testing and look at things like the CBS mutation and look at sulfur intolerance through several sulfur mechanisms, but there's no real great test for it except reduced sulfur in their diet. Now, you'll never reduce sulfur completely because sulfur is in everything, but you can't do a sulfur-free diet. It doesn't exist, but you can do a reduced sulfur diet and you'll find that people get a lot better. The first time I started realizing that I needed to stop eating leeks, it really changed my life because leeks are super high in sulfur and I was sensitive to them. Histamine intolerance, there's a triad that you really need to know about, and that's the mast cell activation syndrome, the POTS syndrome, and the Ehlers-Danlos syndrome. And these all go together. These are all linked together by histamine and by some genes and by some nutritional mechanisms, and they go together. So if you've got somebody that's got postural orthostasis, you've got Ehlers-Danlos syndrome of really weak ligaments and loose joints, and you've got mast cell activation syndrome from Dr. Afrin, who wrote the book Never Bet Against Occam, which is his book about mast cell activation syndrome. You'll learn a lot about this. And sometimes it's histamine that you make in your body, and sometimes it's from an undermethylation problem, and sometimes it's histamine that you eat. Just eating leftovers. If you eat a lot of leftovers and you let your food sit in the fridge for several days, you might have a lot more histamine produced by bacteria and the normal aging process of food as it sits and gets older in your fridge. So be careful of eating leftovers if you're super histamine sensitive. You might also be somebody who really loves kombucha and fermented foods, and that stuff is really healthy for you in most cases, except if you're an undermethylator and you can't break down histamine, you might really suffer from those foods and have to get off them for a while. Citric acid affects children a lot, and it affects behaviors and it affects immune function in some children. MSG is a problem that works together with artificial sweeteners that can cause some bad neurological problems called excitotoxicity. This was talked about by the famous neurosurgeon Russell Blaylock, who is a great hero of mine. And salicylates. Salicylates were also talked about by that marvelous quack Ben Feingold, the medical doctor who talked about salicylates and the sensitivity that children have when they're hyperactive to the salicylates that are in fruit. These are in things like cherries and tomatoes and oranges and citrus fruits. And sometimes these salicylates will make children a little bit hyperactive and not so happy. There are some real cleanses and detoxes. We've done a lot of this for cancer patients as well as for people that have autism and other illnesses that involve them having a combination of being genetically susceptible to toxicology and having a toxic burden in their environment. So we detoxify heavy metals, estrogens and xenoestrogens, pesticides and solvents, mold toxins, lectins. There's all kinds of different ways to do that and to measure that. But if you're not doing that in today's world, that can contribute to a lot of problems. And I should add to this dental toxicity. There's a lot of toxins in teeth. I spent 8 years in the largest holistic dental practice in Minnesota with Dr. Ron King before he died of cancer. And I absolutely loved working with him over this issue. We think he got cancer from some of the types of patients that he worked on. And I wish we could go back and work together again, but he worked on patients with all kinds of dental problems and saved countless people, although he lost his own life. But he did a lot of work with dental poisons and dental toxins. So we got EEG, QEEG, and ERP. These are methods of measuring brain activity. These are measuring cells and cells function based on food chemistry and toxicology. So if you've got really two choices in your brain waves. You're going to have cells that underfire, or you're going to have cells that overfire. And you're going to see beta waves, you're going to see fast waves, you're going to see slow waves. You can see some of those in the same person. But generally, both of them have to do with some kind of metabolic problem. And so what I like to do is look at patients that have had EEGs that confound the doctors, and everybody gives an opinion on it. They try neurofeedback, and sometimes things don't work so well. And then we jump in and try to look at toxicology and nutrition and chemistry. And sometimes we can make a huge difference. And that's what I've been doing for the last 20 years, and practicing for almost 30. And we look at this, we try to figure this out, and I try to learn from the old timers, and I try to learn from the new students, because boy, some of the new students really have got some amazing new theories. I do a lot of carnivore diets and a lot of ketogenic diets. I medically manage ketogenic diets for children with seizure disorders and other brain problems, and we get some very good results, and we have thorny problems that we work out. So that was, I hope, not too long. I would love to take questions, stories, and comments from you guys, and I'm just honored to be here. So, let's talk some more.
Yeah, everyone feel free to either, speak up or you can comment. It looks like we already have one comment, so let's go with that question first. They said, hello, thank you for your talk. Could you share your perspective or experience on microbiome testing, please?
Sure, I can start there. There is some really interesting new science coming out on microbiome testing, and I think it's very interesting. I do want to say that a lot of the microbiome problems that I have run into have been largely fixable by elimination diets. Usually I can find something that the person's eating, and if I can get them off of the food for long enough, I can help their microbiome. I don't have microbiome problems in my carnivore patients. I just want to tell you, my keto patients, my carnivore patients, they don't have those problems. Now, I must tell you that a lot of them get keto flu, which is really a misnomer. Keto flu is really, you and your doctor didn't quite know enough, because most keto flu can be figured out. But the real difficulty with these problems of microbiome difficulties is that the patient needs time to clear out their guts. If you've got just a carb problem, you're going to reverse type 2 diabetes in 2 weeks. But if you have a gut problem that involves lectin binding, you've got proteins that have a half-life of 14 days, which means those proteins are not going to decay and fall off your intestinal lining and the cells of your liver and pancreas and gallbladder and common bile duct for weeks, which means your elimination diet might have to be 12 or 14 weeks long for you to begin to feel better. So the big mistake people make is not knowing which category they're in and not staying on an elimination diet long enough. Because simple diabetes we can change, with if we give you those master cleanse drinks, which is just like water and citrus and sugar, and you sip those every 10 minutes and fast for a couple days, we can control uncontrolled blood sugar very, very easily. We can get it back down to normal by using that. It's almost like an IV drip, but it's by mouth. We can do that, but that works in a couple days to a couple of weeks. But if it's a lectin-based problem or a toxin-based problem, it's not going to get better in 2 weeks. So I think that's the important part. I don't have chronic problems with gut biomes anymore when my patients will go with me and do a keto diet or a carnivore diet. But if they need to do those other things, then I certainly will help them with the plant-based diet where they eat lots and lots of plants. And then we have to work harder. It's okay. It's not an ethical thing. It's just a science thing. I try to tell them, I'm going to have to work harder with you to balance your gut, and we do, and we try. Go ahead. Oh, you're muted, Amina.
Hi, sorry. Thanks. Can I
There
ask
we
a
go.
follow-up question about that? I just wanted
Of
to know,
course.
do you use any of the commercially available testing kits, or do you ever test it to see what their microbial diversity is?
Yeah, I've done some of it, but I don't do a lot of it now. I don't have it as part of my routine work because, like I said, if I can get people on a 14-week lectin-free diet, I don't have any troubles. And I've had some people do follow-ups, and I just wasn't too worried. If I have a vegetarian patient or a vegan patient or someone who insists on a very high plant-based diet for whatever reason, then yeah, we'll dive into that, and we'll test for stool organisms as well as microbiome testing. We'll look at dysbiosis as well as the microbiome, and organic acids as well, because organic acids will measure things like yeast actually better than a stool test would, because of the way that metabolism of yeast works. Yeast burrows itself into the cell, and so you won't see a lot of yeast in stool, but you'll see the yeast metabolites show up in urine because they can't hide that. The yeast can't hide that from the body. So it's a good science. It's a good science, and we're learning more and more every day. I think there's going to be a lot more discoveries. Any more comments on that or questions? I've been shocked at how easy it was to help bloating with patients by eliminating lectins, but lectins are really hard because, again, there's no lab test for them.
I have a quick question.
Sure.
So I know of several people who drink probably about 4 or more diet sodas a day. And there's so much talk about out there, you know, that people turn to them because they don't want the sugar from the real, but then you hear the artificial sugars are so bad for you. I just wondered what your uptake is on that.
Well, my opinion is the artificial sugars are worse in most cases, because the enteric nervous system is a gut brain, and it's nearly as big as a brain, and it's amazing. I mean, it's nearly as big as brains in smaller animals. And so your enteric nervous system is a brain. And when you give it excitotoxins, as Russell Blaylock says, you're really, really messing with it and causing excitotoxicity. You're creating what essentially would be beta spindling in the gut. If you can imagine beta spindling in the brain, you're creating beta spindling in the gut. And that's really bad for the vagus nerve. It's really bad for, you know, the vagus nerve is 80% sensory as far as afferent. And so you're sending this barrage of signal to the brain that gives a lot of signal about nothing. And it's really terrible for the brain centers. It's terrible for anxiety. It's terrible for dysbiosis. And I'm not even sure that it's safe regarding cancer. So I might ask the question, if the patient is insistent on having a sweet beverage, there's something wrong with their metabolism. Healthy people around the world don't crave sweet beverages. They just don't. So when somebody says, I must have a sweet beverage, I'm going to say, I need you to negotiate with me and realize that someday down the road, maybe not today, someday down the road, we need to get you to the point where you don't crave sweet drinks anymore, and you just don't crave them. And if you'll believe that and work with me, we'll get there. Now, I'm not going to make you do it today, but, you know, let's try. I mean, if I'm going to use a sweetener for somebody that's really in trouble, I'm going to try to use stevia, because it's the only thing that's not non-caloric and non-poisonous. But stevia still drives your centers of sweet. And so you're still going to have insulin surges on stevia, which sounds crazy. But you'll see Paul Saladino talk about that, of the carnivore code. He's a wonderful medical doctor who dispels a lot of myths about carnivore diets. Not everybody needs a carnivore diet. I don't want you to hear that from me. But if somebody's got a craving for sweet foods and sweets, there's something wrong, because cultures around the world don't crave sweet, except for children. Children crave sweets when they're growing up. But when they get to a marginal age of pre-adolescent, they don't crave sugar anymore. And cultures around the world don't largely crave sweets. If they do, they're missing pH, minerals, acids, base, alkaline, cell buffers. They're missing lots of stuff. They're missing amino acids and saturated fats. Don't get me started on saturated fats.
There's another question out here about, do you have a general suggestion for those with POTS symptoms after COVID?
Yeah, if somebody's got POTS after COVID, one of the things we have to eliminate is, you know, in diagnosis, I used to teach neurodiagnosis and differential diagnosis for years. One of the things you have to do is rule out, right? You've got to rule out stuff that seems pretty prominent. So if somebody presents with POTS after COVID, you have to ask yourself, did they trigger a latent undermethylation or methylation problem? So what I would do is I would do the Walsh test, and I would look at methylation of histamine, and I would look at their whole blood histamine. Even though it's not completely accurate, I would still do it. He looks at their whole blood histamine. I would look at their SAM-SAW ratio, which is the SAM to SAH, you know, S-adenosylmethionine. You guys are into that because that's involved in the depression pathway and the methylation pathway. So I would look at that, and I would start looking at their chemistry. I would ask them all the methylation questions, because there's a series of questions you can ask people if you're not able to access labs, or you got maybe a little child and you don't want to draw blood on them. You might just ask questions, and there's a whole series of questions that Walsh talks about that are questions that tend toward undermethylation and tend toward overmethylation. About 80% of subjects are undermethylators, and about 20% of subjects are overmethylators. Overmethylation is much less common, but it can be devastating. And so you can look for that, and you can figure that out. And I think the last thing I'll say about that is you can get really hung up with POTS and methylation and histamine if you don't understand the difference between cell cycle methylation and DNA methylation, DNA histone methylation. These are two different things. And you're going to have a lot of people out there showing diagrams of the methylation pathway of how you make S-adenosylmethionine and how you make homocysteine, and they're going to be looking at that. That's the cell cycle. That is cellular chemistry, and that's where you ultimately make neurotransmitters, and that's what a lot of people are into. What Dr. Walsh says, which is contrary to this, is that DNA methylation actually turns off histones. It turns off the expression of DNA and makes most of your DNA quiet. And he says that that's the general idea behind calming most mental illness and most cancers, is keeping your DNA generally quiet. That generally across the board, as a rule of thumb, and you know what Jay Guckelman says about rule of thumb, right? You cut off the thumb.
Hey, Rebecca has a question.
Yeah, so I'll wrap this up. So what you do is you test for these things, and you look for them, and you try to figure out, is there a problem with DNA methylation, not just cell cycle methylation? That's my message. Okay, what's the next question?
Rebecca?
Yeah, so I had a question more related to the brain celiacs. It's interesting because I've told people I'm gluten intolerant because it affects my brain, not my stomach. And so you gave me a new term that would definitely help me. But I've also noticed that gluten affects me, but if it's gluten with sugar, it's even like more deadly. So I was wanting to know a little bit more on that.
Well, there's a molecule called wheat germ agglutinin, WGA, and it's a lectin in wheat that binds to your insulin receptor, and it causes insulin resistance. So that if you take sugar and you take gluten, you might be one of those people that gets severe insulin resistance and gets reactive hypoglycemias, where your blood sugar goes up and down. There is a lab test called enterolab.com. Enterolab.com starts with an E. Enterolab does I believe it's a blood test or a cheek swab for the HLA2 and HLA8 gene test to tell whether you tend to be more brain celiac or gut celiac. You can also do antibody tests to see if you have true celiac disease in your gut, but a lot of people don't have that, but they still can't tolerate gluten because they're not classic celiacs. So don't take a negative celiac as a negative celiac antibody test as gospel that says you're fine and you can eat gluten. All that means is you don't have the classic celiac disease, and you might have some other sensitivity. Good question. Good to see you, Rebecca.
Yeah, thanks. That was HL82.
It's HLA2 and HLA8, I believe.
Okay, thank you.
2 and 8, those are the two tests, and those are the ones that differentiate between brain and small intestine. Those are gene tests. Now, your medical doctor will give you a celiac test, which is an antibody test of your blood for transglutaminase and for alpha gliadin. Those are the two tests that are done for your celiac disease. Now, the gold standard for celiac is to stick a tube down your throat and actually take a sample of your small intestine. But since the blood test is about 98-99% accurate, we just do antibody testing for celiac disease.
Excellent.
Good questions, all. Oh, there's Sarah. Hey, Sarah. Good to see you. Oh, any other questions? I hope I haven't shut anybody down or bothered anybody by some of my forceful comments, but I'd love to have some pushback. What do you think?
Well, I think that there's a lot of folks out there that, I could sit here and talk to you for hours about all the different things going on inside me, and everybody's the same way. Where do you start, and how do you take?
Sure, you start with blood tests. You start with a basic CBC and chem profile and UA. That's where you start. And you start with a history, and you start with a physical exam. Now, I can't do a physical exam online, but the local doctor can do the physical, and they can listen to the abdomen, which is very important. It's very important to listen to the abdomen with a stethoscope. It's very important to percuss the abdomen. It's very important to palpate the abdomen at depths. And it's important to turn the patient in different positions to move gas around as you palpate them. And it's important to palpate the gallbladder in the side-lying position. So these are things that should be done. But that's how we start with everybody, is a nice long history. 90% of diagnosis comes from history.
And I think that's very valid. You're talking about POTS. there's a lot of folks out there, I'm sure, don't understand some of the symptoms of POTS. And I think your connection between that and Ehlers-Danlos syndrome is quite an interesting connection, that they usually go together. I've seen this as well. And POTS patients are very, the way they respond to medications and everything is totally opposite of what you would expect. Why is that?
Well, a number of these people are undermethylators. Undermethylators do weird things to medication. And if you're an undermethylator, you're going to have a lot of mental health types of problems. And in fact, Dr. Walsh said that a lot of high achievers, like those of you on this call, you know, everybody except me, you guys are all have a higher statistical tendency, including me, to have a higher problem, higher incidence of occurrence of undermethylation. It's very common among humans. And so that undermethylation problem can be from several causes, but the ultimate result is a failure to methylate properly different pathways. And so I think that's what affects the drug metabolism is the methylation pathway in part.
Can you explain some of the symptoms of POTS for those that don't know about it?
Sure. A person will have an unexplained sense of syncope, like they're going to fall over. They may stand up or sit down or change, their head will change altitude from sitting to standing or from lying, and they'll start to get a rapid pulse, or they'll start to get low blood pressure, or they'll start to get high blood pressure. You can have orthostatic hypotension and hypertension, which is when you change elevations, your blood pressure goes up or your blood pressure goes down, your pulse goes up, your pulse goes down. And in healthy, normal people, that shouldn't happen. It should be a quick compensation and you go right back to normal. But when you have one of these problems, your autonomic nervous system goes crazy. And some authors think that it's always autoimmune disease and it's always destruction of the autonomic fibers that are in the nervous system, and that's the only cause of POTS. I don't believe that. I think that POTS can be caused by food. It can come and go. It can be caused by heavy metal toxicity from dental materials. It can be caused by root canals. It can be caused by all kinds of stuff. And it can be reversed. In fact, nearly anything can be reversed. I mean, look at the wonderful work of Dale Bredesen, the neurologist who wrote The End of Alzheimer's. He's reversing Alzheimer's through basically diet.
Interesting.
And he's a medical doctor.
Don't find too many of those around.
Yeah, I think, is it UCLA? I think, is that right? Yeah, and then there's just so many. There's so many. You guys got to go to YouTube and you got to look at, aside from my channel, you also have to look at Low Carb Down Under. Low Carb Down Under is really incredible, and there's a lot of doctors that have a lot more credentials than I do, and they'll talk about all these issues, and I'll help you with them. So you know, if you guys have questions, you want to talk to me, I don't charge for talking to me about finding out how to use me. I do charge for my services, but you know, when people want to talk to me, I don't charge for clinicians that want to ask questions. And so
Sarah's got a question here. Do you see this? I'm really interested in
the work. Go ahead, Sarah. Yes, Sarah, what is your William J. Walsh? Yes.
Yeah, I'm really interested in his work, and I'm doing a lot of online and studying with the work he does, but I'm interested in how it is, or wondering how easy it is to get the checklist, because I work with a lot of autism.
Easy. Yeah, it's online. You'll see it online when you Google it. You'll see it in his book, which is behind me. This one right here, this dark one.
I've got that one. I haven't seen. I've got that. The checklist. I'll have missed it.
Well, he's got some more in his courses on the Walsh Institute, the walshinstitute.org. WalshResearchInstitute.org is his website, WalshResearchInstitute.org, and he's got all kinds of stuff on different special populations, and he breaks it down into each disorder and has these questions. Now, the questionnaires are not 100% accurate, but neither are the labs. It's important for you to realize you should never rely on a lab test and say that, oh, I have this lab test, so I'm absolutely this. There are times that a lab test will fail.
And he talks about that with autism, doing the undermethylation. If you can have undermethylation, but if the person is depressed, has high perfectionist tendencies, it can work against what you say in the methyl status. So
yes. Yeah, so and you know, the undermethylator also has a terrible problem with compliance. One of the features of undermethylation is bad compliance. So, you know, Dr. Ron, you and I, when we don't listen to our doctors, bad doctor.
Bad.
It is. I think that's the challenge with the children as well, is how do you do, because I can't, there's a lot of autistic children are so sensory and they can't manage blood tests. So how do you that's when he said to go with the checklist and stuff like that. But what do you
Well,
do?
Sarah, that's why I went to chef school. That's exactly why I went to chef school, was because I didn't understand how to do these diet changes. And that was where I got immersed in how to change diets in children that are just wedded to, like, the autistic child is classically, you'll hear Robert Melillo talk about this. He's a wonderful resource, Dr. Robert Melillo. He talks about this problem, and he says that they're wedded to mac and cheese. All
Yeah.
they want is gluten and dairy, gluten and dairy, gluten and dairy. So one of the ways that we've worked on with trying to reverse that diet of these kids is to add more saturated fat and pulverized or ground up or blended meat, so that they get more protein and more fat in their mac and cheese. And then we can slowly change the composition of the mac and cheese to be less mac and less cheese and more meat and more fat. And we can then slowly transition the kids away from that diet, because it's hard to go cold turkey. These kids will go bonkers.
Yeah, it's really challenging for us because we're working much more on a functional medicine approach. So yeah, it is really interesting.
They've got gluteomorphine and gliomorphine and soy morphine and caseomorphine produced in their gut naturally by these organisms. And so they're little opiate addicts, they're little heroin addicts.
Yeah.
And it's not their fault, but that's why they're so awful at trying to change their diet.
Yeah. Great, thank you.
It looks like our conversation is going on, but guys, I've got to punch out.
Okay.
If Alexandra, you could secure my computer for me. I know Rebecca has another question. I want you to go on. You guys can see now why I wanted to bring Michael here. This just teases everybody and says, oh my God, I need more information, because that's our whole point about what we do at our center is we don't want to stop and just say, we've got this one tool and everybody, if everybody's a nail, we have a hammer, it works. But let's go forward and try to expand this, because I think this knowledge is out there and it's needed. And we're our worst enemies, and I'll be the first one to say I agree with that. So I got to go, guys. I appreciate it. Thanks a lot. And carry on.
Thanks, Doc.
Yeah,
Okay,
guys, I have
you got
about
it.
3
Thank you,
more
sir.
minutes because I'm gonna have to hop off at 1 as well.
Okay, well, Alexander, we'll cut off with you then, right?
Rebecca, do you have a one?
Yeah. So I just wanted to say, with like faulty lab tests, hopefully this isn't too off topic, where if you have a thyroid problem, I know a lot of friends will say that they're in the normal range on their blood work, but for them, the normal range is not high enough. And so I was wondering what your thoughts were on that.
Well, we use functional ranges in functional medicine, which means there's a lab range of disease. And if you're above or below that range, you've got disease. And if you are in a functional range, that's a much narrower range, which is a healthy range. And we use those, which are kind of put together and cobbled together by different sources, different societies and associations like the Endocrine Society. And they put those together. And those are much more narrow ranges of health. And so we try to say, the first question is the person's lab value that we're looking at above or below the lab value? And then if it is within that, we say, is it above or below the functional value? And we try to work on that. But we always take the medical, lab-based one first, because it's much more dangerous. If you're way out of the lab range, that's much more dangerous and much more urgent than a functional range. So we don't treat functional stuff first. We treat medical stuff first. But yeah, there are functional ranges. And sometimes, the title of Dr. Karazian's book was some long title like, why my thyroid isn't working when all my lab tests are normal. I don't never remember the title of this book, but all the lab tests are normal and they've got clear thyroid disease.
Is Karazian?
Yeah, that's Detoxes Karazian. And I can't for the life of me remember the name of the book, but it's the longest title in
Why does my brain not work?
Yeah, say that, Sarah.
Why does my brain not work? The Karazian Institute. I've done my training through that. It's absolutely brilliant.
Even when my lab tests are normal.
Yeah.
Because people can have functional blockage of receptors and not get a chemical change in their blood work for thyroid, and still have all the nuances of thyroid disorder.
Thank you.
I think his thyroid course is really, really good. It's quite
I used to teach that course.
Did you? Oh,
yep.
Brilliant.
I used to teach that course for Apex for Dr. Karazian. Yep, wonderful stuff. Wonderful stuff. Get his books. Get Dr. Robert Melillo. He's got a great textbook called Neurobehavioral Disorders of Childhood. It's a wonderful textbook. It's a very, very high level neurology book. So it's hard to read, but you guys are used to that. If you can read Niedermeyer, you can read that.
Well, guys, I'm going to have to wrap it up because I have to see a client right now. But Dr. Pierce, thank you so much. This is really incredible. We're going to have a recording available soon. We'll try to get that up on YouTube today or tomorrow. We will also have another discussions with Dr. Ron on February 15th, same time, 12 to 1 p.m. And the topic will be announced soon. So keep an eye out on our Instagram or emails for that update. Thank you all for attending and your questions. This was wonderful.
Thanks, guys.